Hello and welcome to yet another episode of Health Nuggets. On this episode, we look at stroke. Remember, we have adult stroke and pediatric stroke, rather known as childhood stroke. On this episode, our focus is on adult stroke. But in the next episode, we will be bringing you childhood stroke. Thank you for finding time to join us on this episode of Health Nuggets. We hope to inform and educate you on today's topic. My name is Aida Munzatsi and Health Nuggets starts now. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. It is a medical emergency, and therefore prompt treatment is crucial to reduce brain damage and other complications. Now, the diagnosis of stroke is not the end of life if well managed. To help you in understanding today's topic, I managed to interact with a stroke survivor. Let's listen in to Eunice's story.
I used to have very bad headaches, and I just used to assume that it's just a headache. So whenever I went to hospital, I was just given painkillers. Though I had another underlying problem, I had fibroids, so I used to bleed a lot, and my HB became so down. It was around 7.8. So I used to be told the headache is because of the bleeding, the low HB. So it went on for like a year. The headache became so severe, and I was taken to hospital. I was told it was just a migraine and was given more painkillers. I took the painkillers. Within 3 days, the headache now got worse, and I lost my memory. I remember it was at night, and it was now just unbearable. I could not talk. My memory was gone.
Headaches are among the symptoms of stroke. According to experts, this may be accompanied by vomiting and dizziness. The persistent headaches prompted Eunice to seek further medical attention.
You know, I was just there. I could not talk. I could not know who is this. So they took me to hospital. They did an MRI. It was found that I had a stroke, and it had just affected my speech. So I was admitted, and by that time I was just doing everything on my own. I could eat on my own, take a bath, everything, talking. But now I could not recognize people. Even when friends came, I could just tell them, oh, I know you, but I can't remember your name. Yeah, even my mom, she came, my uncles, you know, I could not even differentiate between an uncle and an aunt. There's an uncle of mine, I was calling her Aunt James instead of Uncle James. So I stayed in hospital for like 14 days. When I was brought for a speech therapist. I started learning all over again, everything, ABCD. I started learning. So we went on the 2 weeks. The doctor said, now we will have to just go home, and you'll be coming for the speech therapy. Now when I was just about to come out of hospital, I got worse again. So I just found myself, I cannot tell how it was, but I just found myself in ICU. I was not seeing, I was just talking, but I can't tell you how ICU looks like. It was serious. So I was just convulsing, and I'm in ICU. I stayed there. I can't tell how many days I was there. After that, I started now. You see, the problem was the veins where they could put medicines were all like closed. They were trying to you know, put some medicines, yeah, for me to get better, but it was getting worse because there was nowhere to put, to inject. So they had to get they did some operation here to get the vein, yeah. So I used to now get my medicines from just here. After that, I started responding, yeah. Then I got out of ICU. I started now waking up in HDU. I could now start recognizing people. And you see, it was like the memory was now coming back. You know, God is good. Because, you know, after ICU, my memory started coming back. I stayed in HDU for like less than a week. Then I was taken to the general ward. But now the problem, all my left was gone. I could not move. This hand I was totally incapacitated. I could not walk. This hand, I used to sleep on it, just calling the nurses, please get my hand. Yeah, I could not hold anything.
Though it can be challenging, caring for someone that has been diagnosed with stroke is key. It provides reassurance that their condition will improve with time.
When I came home, you see, I could not do anything still. I could not wash myself. Bathing, I needed somebody to do that for me. Luckily enough, my family members were there for me. They really supported me. My mom came from up country. She came and started now teaching me how to walk all over again, washing me, even my husband, changing my diapers, everything. You know, I could not do anything. Like in the bed, I could just call somebody, yeah, to wheel me to the toilet. Then after that, bring me back. I could not put on my clothes on my own.
I also felt that she should not just lie down. And also I think she felt the same, because slowly by slowly you could find that she was struggling to like sit on her bed. Okay, with assistance, maybe you could take her to the sitting room, to the toilet, to the kitchen. But the thing was not to keep her in bed. And I think maybe that's a problem a mistake many people make. When somebody is in a certain state like that, you just leave them in bed and just hope that they'll get better. But from what I learned is that each and every time that she was doing these things, it gave her hope, it gave her strength.
I must thank my husband, who he always, you know, even if I want something, he could tell me, just get it on your own, try. You know, and it gave me psych, because whenever I tried, like for the first day, the second day I tried, then I could do it. I started washing the plates, washing clothes, just a little, until now I could just do everything. And now I'm even able to cook now. I can even make chapatis.
Okay, so we proceed with our conversation about stroke, and I'm being joined by an expert. And with his help, you're going to look at stroke further. That's you're going to look at what stroke is, how it comes about, the signs and symptoms that you should look out for, as well as the treatment plan that is out there. Daktari, thank you very much for joining us on Health Nuggets tonight.
Well, thank you very much. My name is Sam Guer. I'm a child neurologist based at Ubuntu Neurology. I'm affiliated to Kenyatta University School of Medicine, and I'm also a visiting consultant at Gertrude's Children's Hospital.
Okay, great. So let us look at what stroke is and how it comes about?
A stroke refers to a block in blood supply to the brain. And when there's a block in blood supply to the brain, it causes damage to the brain tissue or death of the brain tissue. And on account of that damage, you have a range of manifestations that are associated with weakness or an impairment of function where that part of the brain would have been responsible for. So that's what we refer to as stroke.
So different parts of the body are affected when one has stroke. Probably we can look at the types of stroke.
Yes.
Yeah.
So stroke can either be ischemic or hemorrhagic. Ischemic to mean it's associated with a blockage to a blood vessel that supplies a specific part of the brain. Hemorrhagic to mean that it's on account of a bleed which then affects a particular part of the brain. And the different types of stroke have different risk factors, but the most common will be the ischemic one, that which is on account of blockage or blood supply to a different part of the brain.
So you've brought in the risk factors. Let's just make our audience understand what risk factors are, and we also look at the risk factors of stroke.
Okay.
Yeah.
So risk factors essentially speak to what are the futures, whether related to you individually or to your circumstance, that make it more likely for you to suffer a particular illness. And in this case, as far as stroke is concerned, we know that certain conditions are related to increased risk. So let's talk about the first one that we talked about, the ischemic stroke, in which there is blockage in blood supply. So if for whatever reason you have an abnormality in the way your blood flows that causes it to clot easily, or causes the cells that are carried in the blood to block blood supply, then you're more likely to suffer stroke. So that speaks to abnormalities of the way your blood clots. It speaks to diseases that involve the way your cells congregate in your blood vessels, like sickle cell. It may also speak to various other factors that are related to the narrowing of the blood vessels, so that as that is aggravated, you have blockage. Now, hemorrhage, on the other hand, is more likely on account of risk factors that increase the possibility of blood of a bleed in the brain. That could be on account of a weakness on the walls of the blood vessels, which then make them too easily rupture. It could be because there is increased pressure in the way blood is flowing in those blood vessels that make them to rupture easily. So all those, among other factors, are responsible for hemorrhagic stroke. So then you think about it this way. In general, we know that if you have hypertension, if you've got diabetes, if you've got lifestyle diseases that make you to be obese, they essentially put you at a higher risk of stroke. If you have abnormalities related to the way your blood clots, that may increase that risk. If you have an inherent or an inborn weakness in your blood vessel, like we call them aneurysm, that's a big name to mean that you have a weakness of the walls of your blood vessel, then they can rupture and give you a stroke. So those are the various risk factors that speak to stroke. Yes.
Okay, so we look at how stroke manifests. As we look at this, we can also bring in the signs and symptoms of a stroke.
Yes. So essentially, stroke will manifest depending on which part of the brain is involved. Okay? So that if the part of the brain that is for speech is affected, then you'll have speech problems. If it's the fact for hearing, it's the fact for motor control, which means control of your muscles, then that will be affected. Most commonly and most obviously manifest to us are those that are associated with the weakness of your muscles, on account of the fact that the part of your brain that is involved in controlling that muscle has been damaged. That's when you get paralysis. or paresis if it's slight weakness. So it could be one-sided, most often it is one-sided, or it could be both-sided. But those are some of the key manifestations. It may come with other issues, because when you damage the brain cells, then you may have an abnormality in the way the electrical activity of your brain works. So you may suffer seizures or convulsions. You may suffer memory issues, because maybe the cells that are responsible for helping with that have been damaged, among other manifestations. Again, the key issue is where has the stroke happened. Yes.
Okay, so looking at the causes of stroke, does the risk factors that you've mentioned, do they play a role?
Yes, correct. So risk factors relate to essentially factors or circumstances, whether individual or your own environmental circumstance, that make you at risk and are related to those causes. So the way the body is that you cannot be at the point of the blood blockage or the blood bleeding when it's happening, isn't it? So you try and relate with what you know of that person and the factors that you get of that person with what could have caused it. So that's why we prefer to say risk factors rather than cause. Yes.
So we will always talk of prevention being better than cure. Let us look at how one can prevent themselves from getting a stroke, and if they have stroke, how do they manage?
So obviously, having identified the risk factors, then it's important to appreciate that controlling these risk factors, if you already have them, or avoiding them, are critical in making you not suffer stroke. And that includes better control of your blood pressure. If you have clotting abnormalities, better control of the same. If those are on account of the drugs that you're taking, maybe a change of those drugs or a modification of those risk factors by adding additional drugs to help modify that risk. It means if you're obese and there's also the likelihood that your vessels may be blocked, essentially cutting down on your weight or taking interventions that will help cover that. I think it's also important to bring forth the fact that with the current COVID-19 pandemic, we've seen lots of stroke cases. And we are aware, at least, that a COVID infection is associated with stroke. So that means all those preventive factors or the preventive measures you will undertake to prevent COVID infection are also critical in the prevention of stroke.
Any other thing you'll want to add?
Well, in general, is to appreciate that when you have a diagnosis of stroke, if you're able to identify that quickly, and in adults that's a bit easier, then there are interventions that can be undertaken to prevent damage to the cells. And those interventions need to be taken within the first 2 hours of diagnosis. So you need to be rushed by an ambulance and taken to a center that has that expertise. And usually what the doctors will be able to do is use, first of all, confirm which type of stroke it is by doing a CT scan. But secondly is use drugs that can help break down, if it's a clot, to break down the clot. If a bleed has happened, then they may want to do procedures that can ease the pressure of the bleed on your brain and therefore prevent further damage. Yes.
Well, thank you very much, Daktari, for sharing that very critical information with our audience.
Okay, most welcome.
Therapies are included in stroke's treatment considerations. Depending on the part of the body affected, the considerations range from speech, physio, or occupational therapies. Stroke patients are encouraged to actively participate in the process.
Though I still have a few challenges because this arm is still a bit heavy, so I still go for physiotherapy. And this leg, I think you've seen me walking. It's still a bit weak, so I'm still working on it. I still do exercises. I wake up very early in the morning to just walk around and do squats, yeah. And even the toes, my toes are still bent, as you can see. I can't do like this for this leg. Yeah, it's a bit, you know, everything is still, the brain has not registered that I should be able to do like this. So I try. Yeah, I'm still working on it. Yeah.
We've seen people being abandoned, families abandoning patients. So maybe you can just give a word to caregivers outside.
Okay, if you're a caregiver and you're a spouse of someone as well, you know, it starts even before you get married. I say this because, you know, people only think about, at that time, people are in love, they think about how wonderful life will be with this person. But this question has to be asked by every person. What if things go bad? What if I get sick, for instance, and I lose my legs or lose my sight? Will this person take care of me? That question has to be asked at that time. And then you also have to reverse that question. If this person gets sick, will you take care of her? If the answer is yes for both, then get married. If the answer is no somewhere, then just expect problems. So it starts there. And when you're going also into marriage, you know, don't have this notion that you'll always live happily ever after. You'll always have challenges, whether it's health, whether it's money, whether it's... So go also with that mindset that you'll have these challenges and you're going in together to solve these challenges, together as a couple. So, like in our case, it was very easy for me just to leave her. I would just say maybe she has her relatives to take care of her. But you see, in the end, we have shared history with her. And this is a person who has also helped me in my times of need. So you cannot just desert her. You have to be strong for her, and you have to at least pull her out of that problem. Yeah, so I can ask caregivers to always stand by their spouse. You need to stand by your spouse, and you need to support your spouse. And in fact, part of that healing is you being next to her.
Yeah, I can really encourage them to never lose hope. I never lost hope even when I was in ICU, you know. I was not seeing, but I had that hope that I'm going to go through it, you know. And I would tell the survivors, those people who have passed through stroke, that there's life after stroke. Stroke doesn't mean that now you are down, now you cannot do anything. Just get up and try to do what you can. Because you see, here I am, I was bad, I was going, I was worse. But I had hopes that it's going to be well, and I'm still working on it. In fact, my next plan is now joining the marathons. Yeah, I'm working on these legs so that I can be able to run. I can't run still at this point.
Well, to you at home, thank you very much for tuning in to Health Nuggets. Remember that early diagnosis will always go a long way, so just pay attention to the signs and symptoms as advised by the expert. Until next time, my name is Aida Muzatsi. See you again next Monday, but always remember that your health matters.